Hi, everyone. Welcome back. I'm Dr. Samantha, the maternity mentor, and we're here again for one of our live Q&A sessions that we have every Monday at 9 p.m. Eastern Standard Time. This is my chance to interact with you guys and your chance to interact with me. We are here to answer any of your questions in the chat, as well as any questions that you have submitted onto any of the videos this week. Remember, please share the channel with your friends and family. Follow us on Facebook, Instagram, and Twitter for additional content. And please like and subscribe to the channel. Liking and subscribing to the channel really helps me out as a content creator. And if you hit the notifications bell, you will get notified of our latest videos that are coming out. We are also proud to say that I have been accepted as part of the YouTube Health platform. YouTube has tried to create a space where they have verified healthcare providers and ensured that they do have the credentials that they say they do, so that you know as a viewer that the information you're receiving is coming from a legitimate healthcare source. So we are a part of that, which is awesome. So I'm going to go ahead and get started with some of the questions that we have in the chat. Remember to please feel free putting in any questions that you have. Hi, Abby. So can a UTI cause vaginal bleeding and spotting? Having some light bleeding, small clots and tissues. My provider said to monitor it, may be a UTI. I'm 32 weeks pregnant and I had preterm labor with my last pregnancy. So that's a great question to open us up. So UTI, if anybody is on and doesn't know, is a urinary tract infection. So this is an infection that happens inside the bladder, and they're really, really common during pregnancy, and they're really, really common in women in general. And this is because it's very easy for bacteria to enter our bladder. There's a tiny hole right above the vagina. That's the urethra. And our urethra is really, really short, and it goes straight into your bladder. And the bladder then contains urine. If you get a little bit of bacteria in there, when you're pregnant, you can't always pee completely. So that bacteria sits in there and it starts to grow, and this causes this infection. And so over time, if this infection is left untreated, it can cause more serious systemic issues, including sepsis. So one of the things that we see when we have vaginal bleeding is that we can have that caused by a urinary tract infection. Oftentimes it's because the entire area becomes inflamed. Sometimes it's because it does invade the vaginal space. So you're talking, it's right next to each other. Sometimes that bacteria will go intravaginally, causing irritation in the vagina, which can cause some bleeding and clots and stuff. Here's the thing. Where I am a little, like I would be telling you I'm a little concerned is when you're having bleeding, especially at 32 weeks pregnant, you want to make sure that they're actually truly investigating the cause. Maybe a UTI, not really sure what that means. I understand the words, but the thing is I would be asking for them to test your urine. They should be having you give a sterile sample, and that sample should be sent off not just for a regular urinalysis to look for bacteria, but also for a culture. So sometimes there will be bacteria that grows in a couple days versus just being seen present at the first sample. In addition, you also want to make sure that they're doing a blood test to make sure that your blood work is not showing signs of a systemic infection, like your white blood cells are getting higher than normal. And for anybody who happens to be pregnant and looking at their blood work, white blood cells are higher in a pregnant woman than they are in the regular woman. So please understand, do not interpret your own blood work, because you will see abnormalities in a pregnant woman that are normal for pregnancy. But I would be wanting to know what's going on there. They should also be doing an ultrasound at this point. You had preterm labor in your previous pregnancy, so I'm sure you're well aware that there are other things that can go on. You know, are you having uterine irritability caused by uterine infection? If this UTI has translated into the uterus, you could end up having some like a preterm labor again. And truly, this is very easy to treat. A urinary tract infection can be treated with antibiotics. So it's extremely important that we nip these in the bud because they are one of the leading causes of preterm birth, miscarriage, stillbirth, low birth weight babies, etc. It can also lead to a lot of other issues for mom. Now, when it comes to bleeding, you need to make sure you're monitoring the characteristics. If there's any change in your characteristics, you need to contact your healthcare provider or go to the hospital to be checked out. You definitely shouldn't see this increasing. I don't like the clots. I don't like the tissue. I'm just going to tell you, if they haven't done an ultrasound just to make sure what's going on, you may just want to go ahead and get that, like go to a hospital to get that checked out. You want to make sure, let's assume this is a UTI that's very, very, very mild. Okay. So what can you do about that? Drink plenty of fluids. Now, you want to make sure that you're balanced. You want to do 64 to 80 ounces of water per day if you can, and or other fluids. If you're going to drink more than 80 ounces and all you drink is water, you need to make sure you have some electrolytes in there. So don't just overdo it with water. That can actually cause its own issues. So make sure you have balanced like liquids that you're drinking, okay? Cranberry juice. Cranberry juice is this big thing. It does not treat a urinary tract infection. It will not kill bacteria. However, it does acidify the bacteria, acidify your urine, which makes it harder for bacteria to grow. As long as you don't have gestational diabetes, you could get some real true blue cranberry juice and you could drink some of that as part of your liquid. Now, when I say real true blue cranberry juice, this is not like ocean spray. That stuff's basically just sugar. You need to get the like organic in a glass cranberry juice that tastes terrible. That's the one that actually can help you out with some of the urinary tract infection stuff. Make sure that you're changing your underwear every single day. Don't douche. Don't do any weird powders or sprays in your vagina. And at night, if you can sleep without underwear, to let the vagina like actually get some air, that's actually better when it comes for infection. The only exception to that, Abby, would be is if at this point in time you're getting enough spotting that goes onto a pad and they want you to monitor that, then you should keep a pad on. But every single time that you're going to the bathroom, you need to put a new pad on, even if it's one drop of blood, because you want fresh pads. You don't want to have anything that's like potentially got some bacteria on it. You want to keep that whole area nice and clean. Don't overdo it with washing either. That's another thing. I just said keep it clean, but that doesn't mean wash, because that will actually reduce your normal vaginal bacteria, which can actually change the microbiome and make it easier for you to have an infection. Now, before I go to you, Gabby, we had several questions kind of leading into this subject about antibiotic use, because the treatment for a urinary tract infection is usually antibiotics. So we actually had two questions. They were basically very similar. One was, my wife is having an UTI. She takes ceftriaxone. Is this safe? The other one was, I'm 17 weeks pregnant. Is it okay to take ceftriaxone? I'm worried it will hurt my baby. So if we get to the point of antibiotics, okay, antibiotics are what we use for bacterial infections. And 9 times out of 10, if you have a urinary tract infection, it should be caused by a bacteria, right? So if you are prescribed an antibiotic, it's extremely important that you take all of it as prescribed. A lot of times with the antibiotics, they make you feel better like right away. And then you feel so much better that you're like, oh, I don't want to take any more because I'm pregnant. I don't want to hurt the baby. But this is actually what leads to antibiotic resistance and causes us to need to use stronger and stronger medications. So if you are getting an antibiotic for treatment, make sure you take it all. Thank you so much. I have an appointment. Yes. Please make sure that they check everything, because you want to just double check, triple check. Urinary tract infections are one of the most serious infections that I do see in a pregnant woman. And as far as like for the two viewers that were prescribed ceftriaxone, probably both for a urinary tract infection, it is safe for pregnancy. It's used all the time. I've seen it, and it's really effective for urinary tract infections and can be used throughout an entire pregnancy. All right. Hi, Gabby. So I got my first period after almost 4 months of being postpartum. I'm on day 7 and I still have bright red blood, flow is medium, no clots, no cramping. Is this normal? The period is unusual for me. Before pregnancy, I did not bleed this long. No one talks about what to expect after your first menstrual cycle. Oh my gosh, apparently I need to do a video. Thank you, Gabby. Okay, so the first thing about a menstrual cycle after, there's actually a lot of stuff. I really should do a video on this. That's a good subject. Okay, so number one of the first things that we actually should probably talk about is the fact that you can actually ovulate and get pregnant before you ever get your first period. So that is a big thing that a lot of people don't know. Actually, I am a very big proponent for a lot of my postpartum moms to do ovulation. So actually, if we notice postpartum, if they're dealing with any, it seems to be only part of the month and not the whole month. My first suspicion is that they're actually ovulating. And so I'll have them start doing ovulation strips to see, because if we catch that they're ovulating and their mood goes worse the couple days afterwards, then most likely what we're dealing with is more of like a PMS type of thing versus a postpartum depression or worsening postpartum depression. So this is a trick. Now, once that happens, generally speaking, once you have a baby, your period changes entirely. Pretty much, I have yet to meet the woman who said everything goes back to exactly normal. Women can go from having these heavy, painful, horrible, awful periods to getting nothing. Their period lasts for like 2 days and then it's done. Other women will have light periods, no pain, nothing like that beforehand. And then afterwards, it's like heavy, long, excruciating, like days on end periods. So honestly, that could be completely normal. Now, it is your first period also, which means you spent 4 months without a flow. Your uterus may sometimes give you a very long, heavy first period because it's shedding all of that lining that kind of needs to come off. And so sometimes that is very normal. But finally, for any of you ladies who are out there wondering, you also need to consider COVID. So one of the things that's come out with COVID-19 very early on, there was a lot of talk about whether COVID-19 and the vaccines were affecting fertility. There was different things about men's fertility and women's fertility. As time has gone on, there's been a lot of research being done. I mean, COVID affects all the body and there's research everywhere about everything. But one thing that has definitively come up is women who were both vaccinated and unvaccinated seem to have had changes to their menstrual cycles. Now, it's probably due to COVID exposure versus vaccines, but I'm not going to say that I know either way for sure because they don't know either way for sure. But it is happening in unvaccinated women who have had a COVID-19 infection. What has been noticed is that periods are longer and heavier. That seems to be the definitive characteristic. Oftentimes, they're also associated with more pain. Now, these menstrual cycles are not seeming to fix themselves spontaneously. They've also seemed to notice that the periods will be shorter, meaning instead of, say, every 28 days, they're happening every 24. Some women are having it much longer. One of the things that they're starting to do to treat this is actually what I call the COVID cocktail, which is a specific set of vitamins that seems to help regulate hormones and stuff for a woman and helps to balance out this hormonal cycle. So so what I say with this, Gabby, is that if you have had any recent COVID exposure, even if you didn't know you had it, remember, a lot of people will get COVID and never have a symptom. They'll never even know they had it. So if you had recently been exposed, it is also possible that this is actually a result of that infection as well that's caused you to have this kind of heavier flow. But ultimately, I think that that is completely normal. Unfortunately, you may have bleeding for up to another 5 days. I would say by day 12 is when I'd be really worried. But I think you could have it up, honestly, 10 to 12 days the first time, and I wouldn't really think about it. There is my video on colors of bleeding that talks about like how much bleeding. If you are bleeding through an entire pad every 2 to 3 hours, that would be a concern. That would be the biggest thing. But flow medium, I'm not worried about that. Okay. And yes, I will do a video. So let's talk about bleeding. We have bleeding questions all the time. I think bleeding is very scary. And we get bleeding questions about during pregnancy. So I'm 6 weeks and 5 days pregnant. I just woke up and I had bleeding this morning. We had intercourse last night. Is this because of the intercourse? And so the answer is it very well could be. So just like bleeding can be caused by infections like the urinary tract infection, sexually transmitted diseases, yeast infections, etc., you can also get bleeding from intercourse. Intercourse, when you're pregnant, your hormones dry out your vaginal tissue. And if you're not using proper lubrication and warm up, honestly, you need foreplay. Foreplay helps to promote blood flow to the vagina. And when you have blood flow to the vagina, you're less likely to tear. So it's extremely important that your body is ready for sex and that you have good lubrication, or else you can have these little micro tears that cause bleeding. So, sex is a very common cause of bleeding in the first trimester. But like I said to Abby, you want to make sure you're going and getting this checked out, because if you don't know what's going on, there's other things that could be causing it. And an example kind of came in with one of our other questions. I'm 18 weeks pregnant and I got my sonography done. Everything seems okay, but I have been bleeding a lot and I had a low-lying placenta until 15 weeks. They say I don't have that problem anymore. What could be the cause of the bleeding in my back and stomach? So a low-lying placenta is another cause of potential bleeding in pregnancy, as well as a subchorionic hemorrhage. These can happen at any time. They can change position. And so when we do the ultrasound, we can figure out where things are at. So let's talk about this placental position. Uterus, you've got your cervix. I love to use my fingers as a cervix because it's pretty accurate. A cervix is long, thick, and closed. And your cervix actually kind of feels and looks like this. If you stuck your fingers in your vagina, you can actually feel your own cervix. Please do that only with the clean fingers if you're going to do that. So long, thick, and closed. It's never actually truly closed because it has to open to dilate to let a baby out. So this little slit right here kind of perfectly represents where the mucus plug goes. The mucus plug is simply a lining of mucus that goes right in that area to help prevent bacteria from going up. So this is it. Back to we've got our uterus, we've got our cervix, okay? So a placenta previa, a complete placenta previa, the placenta sits right on top of your cervix. Okay, so your placenta is the organ that feeds your baby. It's got all these blood vessels on this side, right? And these blood vessels are supposed to go right up against the uterine wall, just like this, okay? And there's blood vessels here, and the two together feed your baby, okay? Now, because this is all open blood vessels, if this lands on top of the cervix and the cervix starts to dilate, you see that little bit of dilation? That's like 1 centimeter, okay? Now you have open blood vessels here, and these blood vessels will start seeping blood through here. This is one of the reasons, Abby, why you want to make sure that you're having an ultrasound done to make sure you know different things, including placental position. So a complete placenta previa is something that if you have this, you have to have a C-section. It's an automatic C-section. You are not having a vaginal birth, because once your cervix starts to dilate, all these blood vessels open and you start to bleed out, and it's a hemorrhage for you and a hemorrhage for baby. It's life-threatening to both of you. So we have to prevent your cervix from ever dilating. And in order to do that, we basically do a proactive C-section around 34 weeks, depending on what's going on. But of course, Braxton Hicks contractions can cause your cervix to start to dilate. So what a Braxton Hicks contraction does is it starts to pull at this cervix. And when it's thinning out, that's the effacement. So this is 0% and this is 100% effaced, okay? And then it's also helping to dilate you open. So we need to prevent that from happening if you've got a complete placenta previa. Now, a partial is like this, okay? It's almost covering. And a low-lying is right next to it, okay? So low-lyings are tricky. With a low-lying placenta, we have to see whether we're going to be able to deliver or not. We do a lot of monitoring, but oftentimes what'll happen is the cervix will dilate and the placenta will just stay off to the side, and you're able to have a vaginal delivery with no problem, okay? Now, sometimes your placenta will move. So if you're like 15 weeks pregnant and your placenta is down here, well, your uterus, it starts out small and it gets big. So this placenta, who might be over the bottom, can kind of migrate up to the top as the uterus gets bigger, which is why sometimes these things will resolve. But if you're having bleeding, we need to double check. The other thing that could happen is you can have a subchorionic hemorrhage, which is a little pool of blood underneath the placenta. This is kind of like, imagine having a bruise on your skin where you break a whole bunch of blood vessels and it gets purple. It's like where a little bit of blood vessels kind of break underneath here and create this pool of blood, and some of it can leak out, and then eventually it oftentimes will resolve itself. Finally, you could also have a placental abruption. So a placental abruption is another medical emergency. This is where the placenta detaches before you deliver the baby. It's a medical emergency. And it can cause severe pain and cramping. And so like when you have that kind of thing, you need to get checked out. But it sometimes will get a tiny placental abruption. So you got this whole placenta and just a little tiny piece. See that? Just a little tiny piece comes up loose. And that can cause some of the symptoms and bleeding without being a medical emergency. But we diagnose that with an ultrasound. So these are all reasons why you can see bleeding. Now, not every single one of these means you're having the baby today, that there's this huge complication. It's just we need to figure out what information we have and how to proceed using it. How long do you cramp in your 12th week of pregnancy? I think that's what it says. It's blocked. Sorry, guys, it's blocked by an emoji for me. How long do you cramp in your 12th week of pregnancy? You should not be cramping at all. So cramping is usually a sign of uterine irritability. So when people use the word cramp, it is a very subjective term, okay? So some people, when they cramp, they're talking about like a menstrual cramp, like an achy thing. Some people, they feel a bit more like a spasm. But during pregnancy, you should not be cramping. That's not something we normally see. Now, one of the most common causes of cramping and preterm labor is actually dehydration. Many women who come in preterm labor will give them a bag of IV fluids, and they're so much better after that. So just understand that you want to make sure that you are staying well hydrated. And the other thing that we find is dehydration and lack of electrolytes. So electrolytes are extremely important for everyone and how our body functions. You need salt, you need potassium. And it's really important that you're getting that. You're getting that balanced amount of fluids. One of the best things that pregnant women can have, as long as you don't have gestational diabetes, is coconut water. Coconut water is actually a really awesome natural electrolyte solution. It's very homeopathic. I can tell you a lot of women in the Caribbean, I'm from South Florida, so we're right in the Caribbean. These women on the islands, they drink coconut water all the time, and they have some of the healthiest pregnancies. And I'll tell you, I've been in the hospital with women in preterm labor, and as long as they don't have gestational diabetes, the OBs and the MFMs, maternal fetal medicine, which are the high-risk doctors, they're all the time telling women to drink coconut water. So it's really good, very, very good for electrolytes. You know, it's a great substance for doing that. So make cramping, you want to get checked out, but you also want to make sure you're drinking plenty of fluids and stuff like that. So, but no cramping. You shouldn't have cramping. Okay. So we had another question that said that she was 39 years old, or she is 39 years old. She had a miscarriage in September and another one again in January. She's pregnant again, and she has started seeing brown spotting and small clots. She's in her 4th week of pregnancy. They did an ultrasound and they saw the baby sac, but she's worried she's having another miscarriage. And I really feel for this mom, because it's very, very, very hard to have repeated miscarriages and threatened miscarriages and have to, kind of go through this. So one of the things is that it's important to know what's going on with your colors. Brown is usually a sign of old blood. And then red is active bleeding. Pink is possibly resolving bleeding or blood mixed with other fluids. When you are early on and you've had history of repeated miscarriage, it's important to get checked out right away. Do we know from a spotting like that early on that it's an automatic miscarriage? No. The best way for us to figure out if it's a miscarriage is to do serum blood tests for pregnancy. So serum is blood, and we test for HCG, which is the human chorionic gonadotropin hormone. So this is the same hormone that when you pee on a pregnancy stick, when you pee on the stick, pregnant thing, it's the same hormone. But with a blood test, you can actually get a number. So we do the blood test, 3 days later, we do it again. And if the number's going up, that's a good sign. If the number's going down, that usually means that you're having a miscarriage. For women who've had repeated miscarriages, I highly, highly recommend you talk to someone about getting genetic counseling to make sure you and your partner don't have any issues. You also want to make sure you're tested for the MTHFR genetic mutation. MTHFR genetic mutation is a mutation that affects how well you can process folic acid. There is some evidence that if you have MTHFR genetic mutation, you may be at higher risk for miscarriage. And this is because you are not able to process folic acid the way everybody else is. And folic acid is so important for a healthy pregnancy. So you want to make sure that you're asking your healthcare provider about testing if you have that. You also want to make sure if you are trying to actively get pregnant, or if you're not sure, that you go ahead and you are taking a prenatal vitamin at all times. I recommend in my practice, women from ages 15 to 48 take a prenatal vitamin. Women between these ages are of childbearing age. A prenatal vitamin is not going to get you pregnant. It is just going to get your body ready for pregnancy. And frankly, if you are in that same period of time that it's going to make your body the healthiest it can to grow a human being, then it is probably also the best vitamin for you just health-wise. So I really, truly recommend that everybody take one, okay? Now, before I go into the next question, any of you guys who are joining me, I'm Dr. Samantha, the maternity mentor. Please feel free to put your questions into the chat. So kind of going along with that idea of making sure you're in the right status and stuff, I had a question that said, my last menstrual period was March 5th, and on March 27th, I used antibiotics and painkillers. I conceived on April 5th. Will it affect my baby? So the answer is it's hard to say, okay? If you conceived after using these medications, most likely it will not. But I think this kind of goes into the MTHFR thing. If you are of childbearing age, or if you know anyone who is of childbearing age, and they are not protecting themselves from pregnancy, meaning they're not using condoms or some kind of birth control, you want to go ahead and make sure every time that you are taking medication, you are taking it as if you were pregnant. So one of the things I prescribe in my practice, I'm in psychiatry now, is I prescribe ADHD medications, okay? ADHD is very common. We have stimulants and we have non-stimulants. And these medications can be just so essential to helping you function better as a human being. ADHD can be severely impactful on your life. ADHD medications are not safe for pregnancy. We cannot use them. And so when I am working with women of childbearing age, one of the things that I have to do with them if they're not preventing pregnancy is that I only prescribe ADHD medications for half the month. So they start their ADHD medications on the first day of their period. And once their period ends, they use ovulation strips until they are ovulating. But once they ovulate, they have to stop their medication until they get their next period. And this is because they are not trying to prevent pregnancy. And so therefore they don't want to expose a potential pregnancy to that. And they recognize the safety concerns. So once an egg has been released, there's a chance that you could get pregnant. And so they stop until they know they're not pregnant. And this is done, and we work together doing this because we make sure every substance that I'm putting into their body is safe for pregnancy, or we're not using it. And so when you guys are out there, if you are not preventing pregnancy, don't just grab the over-the-counter thing and think you can use it. Don't just take a medication. Figure out if it's safe for you if you were pregnant, and make sure that you're putting everything into your body kind of in that respect. I love this name, Jamaican Backyard Gardening. I love it. My wife is 6 weeks pregnant and is dealing with low appetite. How can we support her appetite? This is a great question. So she probably has hyperemesis gravidarum. I had it. It's terrible. It's severe morning sickness, which of course is all day sickness. So there's a couple of things that can be done. First, one of the things that really helps women is a medication called diclegis. Another name for it is Bongesta. And Bongesta and diclegis are simply two over-the-counter medications put together. It's vitamin B6 and it's Unisom. And these two over-the-counter medications put together make these prescription drugs, and they help with morning sickness. And so these are oftentimes prescribed, but a lot of times insurance doesn't cover it. So you can actually just get the vitamin and the Unisom, and she can take it at night, and that can help with nausea. Now, sometimes with this low appetite, we have to try to find sneaky ways to get our nutrition in. So one of the things I tell a lot of my patients, men and women who are needing to get a little bit of extra calories, you hear about doing the boost and different things like that, but those are sometimes hard to drink because they're so thick and it's like a shake. If you can go to the store and get some of those high protein powders, right? And then what you do is you take those high protein powders. I usually recommend vanilla flavored, and you take the tiniest little pinches of it and you add it to everything. So the vanilla flavor will oftentimes just get absorbed by whatever you have. But if you take this little teeny tiny, I'm talking like an eighth of a teaspoon or even less, and you sprinkle it, say, over a piece of meat. If she eats even 1 or 2 or 3 pieces of that meat or rice or beans, then what happens is she gets a little bit of extra calories and protein without a lot of actual physical food. You want to make sure all the food she eats is nutrient dense, okay? So nutrient dense means I'm eating a real food that has lots of natural vitamins and minerals in it, okay? So a Pop-Tart is terrible for you, but rice and beans is very natural. Do I recommend rice and beans for everybody? No, but it's a very natural thing. Or a piece of meat or a salad. These are all whole foods, nutrient dense. And you just take little bites. Finally, one of the things that's also important is our bodies will try to support the baby's nutrition. And so our bodies will let the baby strip out all the vitamins and everything it needs to be a healthy pregnancy. And so she just needs to just take as many little bites and little sips as she can, and she can get through it. If it gets really bad where she's too dizzy and stuff, she probably would need some IV fluids in the hospital. But otherwise, you just encourage little tiny stuff. And the other thing is, I just made a comment about Pop-Tarts, right? Her best bet is whole foods, like whatever that's as natural and nutrient dense. But if she looks at you and says the only thing she can do is take a bite of ice cream every hour, then you get her as much ice cream as she wants. Because right now we're just trying to get her to get something in her body. Okay? So I hope that helps. All right. So we had a question about drying up breast milk. And it said, it's been over a month since I stopped breastfeeding my baby. But if I squeeze my breast, milk still comes out. What should I do? Can it stop me from becoming pregnant? So this is a great question. So first things first, women and men, that's right, men can produce breast milk for a whole bunch of reasons. And one of them can be stress. So stress increases prolactin in the body, and prolactin is the milk-making hormone, okay? And so if we have a lot of prolactin in our body, that can actually cause us to produce milk. If you are a post-breastfeeding woman who's dried up her milk and you're still having a lot of stress and there's a lot of stuff going on, your prolactin level can stay high and you can end up still producing milk. One of the things that can also lead your milk to not completely dry out is if you're stimulating your breast. If you're squeezing your breast, you're squeezing the nipples, that's going to stimulate flow. And the more you're doing that, the worse that it's going to be for trying to dry the milk up. So you want to stick to the tips that I have in my my video. So you want to make sure that you are using cabbage leaves and you're using ice and you're not letting a lot of warm water flow here. After about a month postpartum, if you've stopped breastfeeding, you want to go ahead though also and head to your doctor. They're going to probably do an ultrasound of your breast just to make sure everything looks okay. And then they should also draw your blood, and the blood work should look for your prolactin level. If your prolactin level is too high, we need to look for something called a prolactinoma. This is a benign tumor on the pituitary gland that will secrete prolactin continuously, and this can actually lead to certain issues, including fertility issues. So yes, you do want to make sure you're getting it checked out so that you can ensure that everything's okay. For those of you who are joining me, please feel free to put your questions into the chat. I had a question about twins. So it said, I'm 25 weeks pregnant with twins, and I sometimes feel heavy down there as if I am due for labor. What can I do, and what is the cause? So twins are a very unique pregnancy on their own. Twins are two babies in the same belly, and they are heavy. If you have had babies before, and this is not your first pregnancy, your uterus and pelvis have been stretched out once before at least. And so what can happen is the babies can start to sit really low. One of the things that causes, there's several changes to the body that a lot of us talk about, but a lot of people don't understand what happens. So many of you may or may not have heard about how feet get bigger during pregnancy. Woman's foot gets like bigger and flatter. The nose will also get bigger. And then a lot of women they waddle when they walk, right? They have that low waddle. That's all due to a hormone called relaxin. So relaxin starts working in the body during pregnancy to help start relaxing all of your joints, right? So what it's actually trying to do is relax the pelvis, because the pelvis is kind of static, and this pelvis needs to open up to allow for the baby's head to pass through. I mean, you may or may not have seen the emojis of like passing a watermelon, but babies are pretty big. They can be as big as a small watermelon. And so therefore, we want to make sure that you guys understand that it's got to open up. A lot of stuff happens to give birth. And so relaxin comes in, and its job is to loosen up all the joints, but it loosens them everywhere. So your feet have tons of bones and joints, which is why the feet flatten out and get wider. The nose is a lot of soft cartilage, and that's why that also kind of flattens out and gets bigger. It's where these changes come from. So when you're starting to have a lot of relaxin, if you've already had like a baby before, so you're already looser in general, and now you got two babies like sitting down there, it can really feel like they're low and you're ready for labor. If you're having any kind of back pain, any kind of cramping, any kind of anything, you need to go to the hospital and get checked out. You know, she said that she's 25 weeks and she feels so heavy down there. If you have too much weight pressing on this cervix, remember we're talking about the cervix, if you have like a lot of weight from babies' heads and stuff pushing on that, that can cause this to open. And if that causes this to open, you could have a baby early. And 25-week twins are not going to be that big. You don't have to be 10 centimeters to deliver. So if you're not sure what's going on, the best way is for us to get a look, and that's through ultrasound, because ultrasound is the number one way for us to figure out. We can look and see if your cervix is closed through ultrasound. We can see how big the babies are, what their positions are, etc. And so that's really what I would suggest with that. Hi, Jade. I am Oh my gosh, I'm going to have to figure out how to move this emoji thing. Hold on 1 second. Okay. I am 20 weeks pregnant and I'm experiencing a pulsating heartbeat in one ear. Is this normal? Hard to say. Probably not. Is it a medical emergency? Probably not, but you do need to get it checked out. So we do have an artery. We have several arteries. There's temporal artery right here. So arteries are the blood vessels that feed. They go up to feed the brain, and then you have veins coming back down. And you have some that sit right here because they have to actually feed like the auditory nerves and stuff, right? So it is common for you to hear a heartbeat in your ear. That's actually something that can happen. It oftentimes will happen more so when you have an ear infection. And so it's very important that you understand that you may have an ear infection develop, you may have fluid in the ear. A lot of women will get congested sinuses and all this stuff will be full of fluid, and it causes pressure, which can lead to like sinus headaches and tension headaches. And it can also potentially clog up this area, leading to you being able to hear that like like of a heartbeat, okay? You might even feel it. It might even feel like it's thumping a little bit, okay? The biggest reason why I kind of hesitated, right? We worry about one major thing in pregnancy related to like your heart, which is your blood pressure, okay? So you can start to develop blood pressure issues in the second trimester, and specifically I'm worried about preeclampsia. Preeclampsia is a syndrome that includes high blood pressure. And when you start to notice stuff like a bounding heart rate and stuff like that, which this pulsating in your ear could be, you want to think about whether your blood pressure is okay. So if you had a blood pressure cuff, I would tell you to put it on, sit down, don't take it right away. Just so you guys know, if you ever are worried about your blood pressure, you put your blood pressure cuff on, and then you sit down and you like look at your phone for a few minutes. And you like take a deep breath and you like just kind of just chill, maybe drink some water, and then take your blood pressure. Because if you just throw that cuff on because you're anxious about your blood pressure and then you just take it, it's likely to be high. So you actually want to sit for a second so you can get a better result. Make sure your legs aren't crossed, make sure you're just chill, and you kind of just give it a second and take it. If your blood pressure is a little too high, that could be what's causing that pulsating heartbeat in your ear, and that is something that needs to get checked out. Other signs that are potentially a high blood pressure, and Jade, this would be one of the things, any visual disturbances. So visual disturbances can be blurry vision. It can be tunnel vision. It can be lights or spots in front of your vision. It can be floating things. Anything that's a change in your vision, or if your eyes feel funny, okay? Sometimes women won't have visual changes, but they've said to me, like, my eyes, they just don't feel right. That's all a warning sign of high blood pressure. Also, if you have right abdominal pain. So the right upper abdominal pain, it's usually like an aching or cramping, and that's your liver that's usually not feeling well. So these are a couple of things that you want to look for as far as signs of high blood pressure. But, you know, the pulsating ear, it could actually be like a sinus ear infection type of thing that's kind of starting to happen. And so I would let your doctor know, but definitely if you have the ability to take your blood pressure, take your blood pressure. Because if your blood pressure is high, then that's something you'd want to call tonight and let them know what's going on, probably so that they can go ahead and get you checked out. Guys, don't let anybody make you feel like a hypochondriac during pregnancy. Don't let them do that. Don't let them make you feel bad for calling. Don't let them make you feel bad for your questions. We don't get pregnant that often, and we hear about all of the different complications that can be had. Your doctors signed up to answer your questions. They signed up for middle of the night calls. They signed up for all of this. That is what they're there for. Don't let anybody make you feel bad if you're not sure. It is better to be safe than sorry. That is what they are there for. And I always tell people it's better to ask than to not ask, and it's something that could have been dealt with sooner. Okay, so always ask and don't hesitate. Okay, I am on my last question from your videos, but if you guys have any questions, please feel free to put them into the chat. So my last question, I always try to save my favorite for last, is I treated my anxiety and now my problem is I'm pregnant. I take Jovia. Is this safe? Okay. So for any of you guys who don't know, I am Dr. Samantha. I am the maternity mentor currently practicing in psychiatry. But before I was in psychiatry, I spent 13 years in the hospital. I worked in mother baby. I worked in labor and delivery. I worked in NICU. I worked in antepartum. Antepartum is the part of the hospital where we take pregnant women who are having complications and we keep them pregnant for as long as we possibly can. I've been a lactation consultant for 13 years. I've done specialized training in pharmacology, that's medications for pregnant women. This is what I do. And I went into psychiatry because I found that women were being told they could not take medications when they were pregnant or when they were breastfeeding, which is wrong. So let me tell you some of the things that are important to know. Untreated anxiety and depression during pregnancy can cause miscarriage, preterm birth, stillbirth. It can lead to severe postpartum depression, postpartum anxiety. A scary fact that's out there that not a lot of people talk about, the number one or number two cause of death postpartum in women is suicide. We don't talk about this because that's a scary word and it's something we don't want to think about. But the reality is that it is a very, very transitional time for many people when they are postpartum, and you need a lot of support and it's hard. And so the thing is, if you're going into your postpartum experience already anxious or depressed, that makes things 100 times harder. And so we now know that medicating women with prescription medications during their pregnancy is far safer for them and far safer for their babies. Their babies get exposed to less cortisol. You know, we just think about exposing them to something like Lexapro. When you don't treat your stuff, you're bombarding your baby with all of your stress hormones. Okay? So all that cortisol, epinephrine, all that stuff's crossing over the placenta to the baby. When we use stuff like Lexapro or Zoloft that help to calm anxiety and calm depression, it allows for the baby to get much healthier, like a healthier flow of chemicals. And what are we giving you when we give you Lexapro? So Lexapro replaces and Zoloft. I also mentioned Zoloft because it's the number one prescribed to pregnant women. It's serotonin. We're giving you serotonin. Serotonin is a neurotransmitter. It's a chemical that's in your brain that is used for a variety of different things. And guess what? Your baby needs it too. Your baby is learning how to make serotonin in its own brain. So when you take something that boosts your serotonin, your baby actually feels amazing. And so this is not a bad thing for our babies. And if it helps you to have less stress hormones and a healthier pregnancy, then this means overall it's good for the baby. Jovia is not a medication that's currently used in the U.S. Under that name, but in the U.S. we use Lexapro, which appears to be the same thing. Escitalopram is the other name. So escitalopram and Lexapro are safe for use during pregnancy. There's a variety of different ways that we can use it. Some women choose to not use it in the first trimester and do second and third. Some women choose to come off in the third trimester. There's all different ways. It is a risk versus benefit. There is that you should be discussing. And there are some homeopathic ways to treat mood disorders. If you're struggling with a mood disorder, the number one most evidence-based treatment for that is therapy. Okay, so getting a good therapist on board, somebody to vent to, somebody to help learn what your triggers are, somebody to learn how to manage your triggers, to give you strategies for dealing with low mood or anxiety. That is your number one way to help to mitigate, treat depression and anxiety. But sometimes it is good to take stuff like Lexapro, and that can really help overall. You can enjoy your pregnancy and you can be far healthier going in to that, that postpartum period. I hand wash the baby bottles and nipples, and after 2 months, the nipples are greasy now. It doesn't matter how much I rewash them. How do I remove it? Is it time for them to be replaced? I will tell you, I'm going to tell you what I would do, and I'm going to tell you what you could do. Okay, so I'll go with the could do first. One of my best tips postpartum, which I think is worth the best amount of money, and if anybody is looking for a gift for somebody for a baby shower, you can buy sterilization bags. So I know Medela makes them. I own no stock in Medela, so I'm not making any money off of that. Probably Amita does and other ones. They're basically, you can get like a box on Amazon. There's like 5 bags in it for like around $5 is what it used to cost. And these bags can be used for up to 20 times. So it's not one-time use, it's 20 times. On the back, it shows you that. And you fill it with a little bit of water, you throw your stuff in, and you stick it in the microwave. And it basically sterilizes the baby bottles for you using that. That might or might not help get rid of the greasy. The other thing you can do is try to take good old-fashioned like Dawn, that like nice soft like dishwashing soap, and stick it in like a bucket or a bowl overnight with a lot of it and see if that'll help. I probably would put Dawn straight on it and like try to rub if you want to try to save them. I'm going to tell you though, if it was me, I'd be throwing out those nipples and getting new ones. When people ask me what bottles to use, obviously your baby needs to eat and you need to do what you have to do. But if somebody says, I've never bought a baby bottle before, and they can, one of the things I tell them to do is get the glass bottles. So it is really, really, hard that I have a hard time with the fact that we have to use so much plastic with our, okay? Unfortunately, nipples, there's nothing else you can do. It has to be plastic. There's no other way around it. And bottle feeding, I'm a totally pro bottle feeder. I think bottles are fabulous. But I wish we could do it somehow without plastic nipples. Since we can't, we have to do the best that we can. And so what I do think is once you start to see that, if you really have tried everything you can to try to get that, it could be that the plastic's breaking down. And so, I would tell you that at that point in time, if you ever see guys also like pacifiers, a lot of the pacifiers are kind of, they're clear. You should be looking. If you ever see like on the pacifier, it starts to get cloudy color and it was a clear, you actually want to throw that pacifier away. Those are all signs that the plastic is breaking down, and you want to just be done with that, because we really don't know the full amounts of our, like what's in our plastics. But again, I am pacifier too. Pacifiers are recommended by the American Academy of Pediatrics once breastfeeding is established, if you're going to breastfeed, otherwise immediately if you're going to be formula feeding, because it helps reduce the risk of SIDS, sudden infant death syndrome. So in our society, because we're pushing a lot of breastfeeding, which is fine, we are basically kind of being manipulated into this idea that pacifiers are bad. Pacifiers are not bad. And your baby can be offered a pacifier and doesn't need to use a pacifier until they're 4. The reason why babies use pacifiers that long is because of the parents, not the baby. So pacifiers reduce the risk of SIDS. And the reason why they think that is that when you have a pacifier in your mouth, the baby's lighter state of sleep. So they're kind of being stimulated to stay a little bit more awake. This is oftentimes why parents don't like to use pacifiers during sleep, because then they'll say like, oh, but then I have to go get the pacifier. Well, as your baby gets older, your baby will actually take the pacifier and put it back in its mouth once it's able to. But in the short term, yes, you might have to replace pacifiers. But if you think about it, this means the baby is waking up. And that awake state means that the baby is not too asleep. And we don't know what causes SIDS. We don't know for sure. So we want to make sure we're doing everything we can to keep the baby safe. And this is one of the things you can do. So I'm very pro pacifier, and pacifiers have to be plastic. But just like with Gabby and her nipples that are starting to not be able to get cleaned, it's probably breakdown. So I would get rid of them. I get new nipples because the rest of the bottle is still totally fine. And again, look at your pacifiers and stuff. So I hope that helped, Gabby. The sterilizing bags by Dr. Brown's makes it worse. Good to know. Maybe I'll have to do a review on all of them. I haven't tried them out in a long time. It's such a time-saving trick for a lot of people that I really like them. So I am Dr. Samantha. I am the maternity mentor. I am here every Monday at 9 p.m. Eastern Standard Time to answer your questions live, as well as any questions that you have submitted onto the channel. Thank you so much for being here. Thank you for supporting me. Please like and subscribe. Subscribe. This really helps me out as a content creator. Share the channel with your friends and family. Follow me over on social media. I'm there all the time. I have taken a couple weeks hiatus for videos because I have been dealing with COVID for the last 3 weeks. I'm finally coming out of it. So hopefully this weekend I will be filming and we will get some new content out. We are publishing a video out tomorrow, so take a look out for that. I'm looking at my producer right now. It is our video on diapering and issues related to diapering. So please check that out if you haven't. We will be back next week. Thank you, Jamaican Backyard Gardening. I really hope I answered your question, and I love your name. I love your username. Spot on. So if you guys need anything at all, please feel free to put your comments onto the videos during the week. We are the ones we're looking at. I answer them all the time, and I love your suggestions. I am definitely going to be adding Gabby's suggestion for a menstruation video to my list. I appreciate you. Thank you so much for being here. I'm Dr. Samantha, the maternity mentor. Bye for now.